Question is for the Minister of Health and Long-Term Care. Minister, in the spring you introduced the Patients First Act to further improve patient access and experience. This bill, formerly known as Bill 210, included a plan to transform the healthcare system into one that puts the needs of the patient at its centre. I've often heard from my constituents in Davenport about their concerns, and really about concerns from many Ontarians, about access and the ability of our healthcare system to meet the growing needs of Ontarians for today and into the future. So I'm pleased that our government was introducing a bill that would help modernize our healthcare system to better respond to patient needs. Speaker, can the Minister of Health please update this House on the government's plan to put patients first?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. Thank you to the member from Davenport for this important question. And I want to once again acknowledge the abundance of talent that's represented by our healthcare sector partners in the gallery today that have joined us. It's an important day, Mr. Speaker. We've listened to Ontarians and we've heard their concerns. I want this province to know that this government is committed to making sure our healthcare system directly reflects patients' needs, Mr. Speaker. And later today, I will reintroduce the Patients First Act, which would, if passed, put patients at the absolute centre of a truly integrated healthcare system. It would give Ontario's 14 LHINs the ability to connect all parts of the healthcare system, including primary care and home and community care, to improve the planning and delivery of frontline services to patients. This will mean easier and more equitable access to care and better coordination and continuity of care, Mr. Speaker.
Thank you. Supplementary.
Thank you, Speaker, and thank you to the Minister for that response. I know our government has worked hard to ensure that patients are at the centre of Ontario's healthcare system, and I understand that the proposed system changes would strengthen local healthcare planning and increase efficiency to allow for more funding to be directed to patient care. I'm also pleased to hear that our government is recognizing the importance of French language in the provision of healthcare services and honouring our commitment to meaningful engagement with our Indigenous partners. Speaker, can the Minister of Health and Long-Term Care please tell this House about what this proposed legislation could mean for Ontarians?
Thank you, Mr. Speaker, and thanks again to the member. The Patients First Act, if passed, will be the next step in our government's efforts to build a better Ontario for patients, Mr. Speaker. Our plan includes priority initiatives that we know are important to Ontarians, including expanding access to home and community care and ensuring that every Ontarian has access to a primary care provider. These proposed legislative changes reflect our vision for creating a truly integrated system that facilitates local health care planning to ensure that patients receive more equitable access to care that meets their needs, establishes a formal relationship, importantly, Mr. Speaker, between our LHINs and our local boards of health to support joint health services planning, and most importantly ensures that patient voices are at the heart of a system that is accountable to patients and connects them with the care that they need.